Hi everyone, welcome to our e-Microlearning series organized by the Faculty of Pharmacy UITM. I'm your moderator, Dr. John Sia. It is our great pleasure to have Dr. Hanis Hanum Zulkifly with us today to talk about Virtual OSCE, Challenges and Opportunity. Ladies and gentlemen, OSCE stands for Objective Structured Clinical Examination. It is used to assess the clinical competency of pharmacy students, and it has been particularly challenging to have it face-to-face during this COVID pandemic. Before Dr. Hanis starts her sharing session, please allow me to briefly introduce her. Dr. Hanis is a registered pharmacist by profession. She received a master's degree in clinical pharmacy from the University of Queensland, Australia back in 2011, and a PhD from the University of Birmingham, United Kingdom recently. Her current research interest is in stroke prevention in atrial fibrillation. So without further ado, please welcome Dr. Hanis. Dr. Hanis, please.
Hi, good morning, everyone. Good afternoon, everyone. Thank you for the kind introduction, Dr. John. Thank you to the organizing committee for inviting me to share my experience with Virtual OSCE. Let me just share my slides. Right, can everybody see?
Yes, Dr. Hanis, you can see the slides.
All right. So I'll be talking about the challenges and the opportunities while handling this virtual OSCE. So, okay, so this is actually how I felt when I was given the task to run this virtual OSCE. I think, it's quite normal for everybody to feel the same way if they are given a new thing to do. So to be honest, I've never handled OSCE face-to-face. I was in the team to support them, to give them cases, but I never had to handle it from scratch. So I was very nervous. I was confused, I was scared, and all together. But then I took it as a challenge and go ahead and proceed with it. I must tell you, it was not all roses from the beginning. It was such a roller coaster ride for me and my team, but in the end, we managed. So I'm not an expert, but I would like to share with all of you of what we've went through with Virtual OSCE. Okay. Oops. Right, so this is the outline of my talk today. The 2 W's and the 1 H of our Virtual OSCE. And then our experience with Virtual OSCE and 10 tips of handling our Virtual OSCE. So the challenges and opportunities are embedded within these 3 subtopics. So before we begin, what is actually OSCE? So for those who doesn't know what OSCE is, as mentioned by Dr. John, it is an objective structured clinical examination. Okay, it is widely used in many healthcare programs, including dentistry, including pharmacy, including medicine. So in Malaysia, almost all of the public pharmacy schools use OSCE as part of their assessment. So UKM uses it, UIA uses it, UM uses it, USM uses it, and UITM as well, and some other private universities. So we've all been using OSCE as part of our assessment for our pharmacy students. Okay, so why do you conduct OSCE? So, because OSCE, it emphasizes problem-based teaching and competencies, and the gold standard, and it is a gold standard for evaluation of clinical skills. The assessment covers interpersonal and communication skills, professional judgment, and skills of resolution. These are the aspects that could not be assessed by your normal exams. So we all know when we have our normal summative exams, in the final exams, you are given a problem and you have to answer it. We don't test your interpersonal skills, your communication skills. And with OSCE, time is key. Everything is time. All of the tasks and all of the questions are being timed. So if you can't answer the task given within the specific time, you will not get you will not get the marks. Okay, so time is really a key in OSCE. Now, ideally, how is OSCE conducted? Okay, so it requires students to rotate through multiple stations, station 1, 2, 3, to demonstrate competence tasks representing a range of clinical areas. So it could be assessing their history-taking skill, it could be assessing their counseling skill, it could be assessing their a wide varieties of clinical areas. Like for medical students, it could be assessing their skills on how to examine the patient. Yeah. So these are the skills that you can't obtain while through taking your normal exams, your normal exams in exam halls. Okay. And tasks or stations are time limited, and it usually varies from 5 minutes to 30 minutes. Okay. In OSCE, actors are needed as standardized patients, or known as SPs, or standardized healthcare providers, to simulate the real world scenarios. Because these professions, pharmacists, nurses, dentists, we deal with patients, we deal with healthcare providers. So we have to train our students on how to deal with these people, our stakeholders. Yeah. So, and hence that's why OSCE is being recommended in all these healthcare programs. So going on to our experience with virtual OSCE. So we had 3 cohorts of pharmacy students that undergo OSCE. We had the first cohort was the 3rd year students, second cohort was 4th year student, and the third cohort was again the 4th year students. So they all had to go. The 3rd year students, we did the OSCE on the 7th of January, the 4th year students on the 14th and 15th. So twice, the 4th year students had to do OSCE for twice because it covers different course codes. Okay? So we had a big number of students. For 3rd year, we had to handle 183 students, whereas the final year, 183 students and 188 for the second OSCE. So we had 23 lecturers involved as examiners for these students. So we divided each lecturer to handle 9 students during the virtual OSCE. Okay. SP, simulation, we had for the 3rd year, we had a video recorded SP to simulate the actual real world situation. And for the final year, we had OSCE, who are our alumni, who are our students who have just finished their bachelor's degree program last year. So 23 of them were involved. Okay, so the medium that we used was Google Meet, and the task that was involved for the 3rd year was 2 tasks. One was prescription screening, and the second one was device counseling. Okay, those are for the 3rd year. Whereas for the final year, They had to do history taking, they had to solve drug-related problems, and they had to do counseling. Okay? So you can see here twice because these are offered for 2 different codes. Now, what happened with our third year OSCE? Okay, like I said, we had 2 stations, okay, where in the first station, they had to do screening of a prescription, and they had to identify what are the problems with this prescription. So they are given 5 minutes to look at the prescription, to identify what is the problem with the prescription, and to recommend effective solution. Okay, so this is the prescription, and this is the instruction on what they need to do. So they have to do that within 5 minutes. As you can see in this picture, on your left is the examiner, and on your right is your student. Okay, so when the time finish, when 5 minutes is up, the examiner will stop the student, even though she's speaking. They will stop the student and they will move to the next station. So in this session, the examiners control the movement, not to say the movement, control, the examiners had to share screen the prescription. So when the 5 minutes is up, it will go to the next station. So this is the first station. They'll just have to scroll down their PDF attachment to the next station like this. Okay, so this is second station, okay, where they have to watch a video. This is the simulated patient who actually shared how he was using his MDI. So the student is supposed to identify what was the problem with the counseling technique, and then they had to counsel back the correct way. Okay, so sorry, before this, there is an instruction on what the student should be doing. So this should happen in 7 minutes. Okay, so that's what the third year OSCE was like. Okay, so in terms of when the student finished the first and the second station, then that's it. The session for that student ends. Okay, so we had to do this for 182 students, which was broken up into 23 lecturers. Now, when we were done with the OSCE session, we obtained some feedback from the students. They said it was okay, but then some of them had told us that the video did not tally with the audio, and there were some problems. The time was not enough. Okay, the instruction is very clear, but the time is not sufficient, especially during station 1. So, and then some of them wanted a timer on the screen that was shared. Yeah. Then some positive feedback saying that OSCE, I like the objective of OSCE because there I know what I lack and need to improve myself. However, I suggest to give more time to complete the task 1 as this was the first time. Okay. In terms of examiners' feedback, the majority of them agreed with the utilization of Google Meet as the OSCE medium and Google Form as the evaluation form. So we had evaluation form and everything was transferred into Google Form. Okay, some of the examiners, they suggested to allocate a buffer time to allow for marking because they had to mark straight away when they were listening to the patient presenting their task. They had to straight away give the marks. So some of them wanted a buffer time for that. Okay, and some of them also wanted a trial session for the examiner. So that was our experience with the third year OSCEs. Okay, coming to the final year OSCE. So this happened a week after the third year OSCE. So we had a different batch of students. These are the final year students. Okay, so this OSCE for the final year students, there were 4 stations. Yeah, unlike the third year, there was only 2 stations. The final year students had 4 stations. Okay, so what happened actually in all of the 4 stations? Okay, in station 1, they are given 2 minutes to read the instruction. Okay, so in station 1, we will give a case synopsis. Okay, and then they are given 2 minutes to read and try to understand what the case is about. So it's quite a short case synopsis, telling why the patient is admitted to the ward or come to your community pharmacy, that sort of things. So they had to read and understand that within the 2 minutes. Then when the 2 minutes is up, the examiner will stop them and go on to second station, which is the history taking station. So this station lasts for 5 minutes. So the student will see this in front of their computer. Yeah, they'll see station 2. They will know that this is a history taking station, and they have 5 minutes to complete the task. So here we have the instruction, okay, what they should do. So in this station, they should conduct history taking and interview the patient on the current condition and medication. Okay, so as you can see, here is the picture of the simulated patient, which was our alumni. And so basically, the student will be obtaining history from this simulated patient. Okay, of course, the simulated patient, we have already given them a script beforehand, and we have actually had a briefing session to tell them on what they should do. So they should be reading, answering the questions from the from the student based on the script. So anything that is outside the script, they will have to say, I don't know, I'm not sure. Okay, so in this station, the competency tested is development of professional relationship, obtaining information, and establishment of effective communication skill. Now, if the students do not take a proper history taking for station 2, they would not know what is the problem, because in station 1, they only see a 4 to 5 line of case synopsis. So the case synopsis doesn't give them much clue. They will have to get the clues from the patient. What brings the patient to the hospital? What are the medication that the patient took that brings the patient to the hospital? So you will have to do this history taking very well in order to know what's going on and how to go to the next station. Okay, so station 3, when the 5 minutes is up, the examiner will stop the patient from talking to the SP. Then they will go to station 3. So this is a station where the students will have to solve any drug-related problem, and they will have to speak to the examiner. So, like I said, if they do not understand the case synopsis, and if they do not do a proper history taking, they will not be able to solve any problems at this point. So they will have to do station 1 and 2 correctly in order to know what's going on with the patient. Okay, so they are given 5 minutes to do this task, and the instruction is given down here. Okay, so this is the part where students, from our experience, this is the part where students could not perform because sometimes they could not understand what is going on with the patient. Okay, so the competency tested in here in this station is to identify and provide recommendation to resolve drug-related problem. So even if they identify the drug-related problem, but if they do not give a proper solution or justification, they will not get marks at those various points. Okay, so when the 5 minutes is up, the examiner again will stop the student, and will go to the next station, station 4. This is the last station, okay, where the students will have to do discharge counseling. So in this station, we will share screen of a discharge prescription, and they will have to do the discharge counseling alongside with non-pharmacological intervention. Okay, right. So again, when the cycle complete, they will have to leave the GMIT session, and then the examiner will call the next student until all of the students is finished. Nine of the students is finished. Okay, so we obtained some feedback from the student. They said, the lecturers and SPs were helpful and cooperative. Overall, it's good. They enjoyed OSCE. It's a new experience for them because they've never had it before. Okay. Overall, it was okay. What I learned from OSCE is I needed to be prepared in whatever condition I'm in, to think fast and to be well organized on whatever information that I want to give, especially when counseling on the patient, on the medication prescribed for them. Okay. So these are the SP's feedback, so simulated patient feedback, because they were our alumni, they were our students. So they were quite happy with it. So it was a new experience. But then some of them said they wanted more training session by us to ensure that everything was okay. Okay. Some of them said everything was okay except the internet connection had been the main problem to conduct the sessions smoothly. So it's quite common with all our Gmeet session, WebEx session, when sometimes there's internet problem, they had to go out and then come in again. So those were the problems experienced by SP examiners and students as well. Okay, so done with the third year and the final year OSCEs. So I would like to share some tips on how to conduct this virtually. So I actually adopted from an article from Hopwood et al. They did OSCEs for their medical students. So yeah, so the first tip is plan in advance. Okay, first of all, you need to plan. What type of case do you want to ask? What type of task do you want to give to the students? And this has to be based on your course learning outcome. And then what skills do you want to test them? Is it just cognitive? Is it psychomotor? So these are the things that you need to sit down and discuss with your teaching team to make sure that it is mapped against all these skills asked. And then you need to plan how the flow would be like. Of course, it looks very simple, but then the planning took a long time for us because we had to change from one plan to another to suit the current situation. I'll show you in a bit what I mean. Okay, and then you have to know how many staff you want to involve. Okay, like us, we had 180 plus students, so we had 23 lecturers, and then we needed simulated patients. So all of those have to be planned. Okay, and what medium to use? Do you want to use WebEx or do you want to use Google Meet? Okay, so our initial plan was a hybrid plan. What do I mean by hybrid plan? So initially, we wanted the lecturers to be present at the Faculty of Pharmacy, in the computer room, so that we can control the timing and we can control everything at the lab computer. So we were going to use WebEx with record sessions, okay, where we have 2 tracks and 2 hosts, okay. So this was our initial plan, okay, where we have track 1 with 20 students and 20 examiners and 20 SPs, and track 2 with another 20 students, another 10 students, another 10 examiners, and they are handled via different hosts. Okay, this was our initial plan. Okay, however, right, so we have given all the briefing to the students, where we will call them 10 by 10, okay, by a host. And they will be taken into all these breakout sessions via a host. Okay, we've planned this all nice and well. However, just one day before the OSCE, just 24 hours before the OSCE, we had an email coming from the faculty saying that there was a problem with the internet connection. So thus we had changed everything to a full OSCE in 24 hours. So in the end, we had this OSCE like this, where all the examiners sit at their own home and conduct the OSCE and time it by themselves. So within that 24 hours, we because when we were planning to do it in the lab, we already planned to print out all the student grouping, the case notes and everything, but then everything had to change. So we had to change everything virtually within 24 hours and come up to like this, to what I've said just now, full 100% online mode instead of hybrid. Okay, my second tip is have a good team. I cannot emphasize how important it is to have a good team, to have the support from the management to ensure that everything what we're doing is in the correct way, to have technical support, because like I said, it looks easy, but all the teeny tiny bits of conducting the OSCE, of making sure the students are in the correct group, the lecturers receive the correct name of students, to make sure that the lecturers know where to mark and where to get the Google form, the Google Meet link and everything. It requires a lot of planning and support from the technical team. And the support from academic staff for case building, because we had 5 cases for the first, we had various different cases, so it requires a team to create cases as well. Now, my third tip is to modify your stations for online setup, because remember, we had to convert this OSCE from face-to-face to virtual OSCE. Because in real life, the students had to move around from one station to another station. But in virtual OSCE, it all depends on the examiners to moderate the whole process. And then the students will have to do it all virtually, to do history taking virtually, to do drug counseling virtually instead of face-to-face. Okay? And prescriptions and cases are shared on the screen instead of hard copies like they are used to in the face-to-face. And all SPs and examiners had to be ready virtually. So before the OSCE day at 6:30, 7:30, all of us were already on our phones. We had various WhatsApp groups to remind everybody to be ready in front of their screens, as well as reminded students as well, all to be ready by 8. Be confident and creative. Like I said, initial plan was a hybrid plan, but we had to change everything within 24 hours. So it was I don't know how to say it, how to put this in words. It was I don't know. It was really mind-blowing for us to do everything within 24 hours. Okay? Be creative. Like the third year OSCE, we had to record the SP rather than having a live SP like fourth year. Then all the assessment sheets were converted to Google form. So I think this is one advantage, because when everything is converted into Google form, the coordinators will get all the marks straight away, rather than asking all the examiners to email them one by one. Okay? And then we convert everything to 100% online, okay, instead of hybrid. Now, extra training, the fifth tip is extra training for the virtual OSCE. And this applies to students, examiners, and SP. Okay? So we did brief the student a couple of times, brief the examiners a couple of times on how actually this is going to happen. Okay? We actually conducted few tutorials, with examiners who are still not comfortable with virtual. We had to do all of those to make sure that everything will be fine before the OSCE day. Okay, tip number 6 is keep the focus on the candidate during the assessment. Okay, we told the lecturers if they're not comfortable using Google Form or using marking straight away, they can print hard copies of the assessment and then mark later when all of the 9 students are finished. Okay, and as well as print hard copies of the student because each lecturer will have about 9 to 10 students. So they'll need to check whether the student is in the correct Google Meet or not. So I think it's quite handy to have them as hard copies. And all sessions were recorded, yeah, because I think this is very good, because in case that we needed to remark or to check back, we have all the evidence, okay, via the recorded session. Okay, tip number 7 is to optimize what is shown on the candidate screen. So it's very important to have a clear instruction on what the student should do, because if not, they would not, because students are very nervous during OSCE. Even though they could read the instruction, sometimes it doesn't go inside their mind. So I find it quite helpful when the examiners try to calm the students down and try to let the students have their time to read the instruction, because the instruction will tell them what to do. Okay, the case summary. Okay, again, the students are supposed to understand and read the case summary in station 1 to ensure that they know what is going on and what is the problem. Okay, time was also shown on the shared screen. Okay, for every station we highlighted how many minutes is allocated for that time for that station. Okay, and prescription. So prescription was also shown on the screen as well. If the patient can't see the prescription, they will tell the examiners to enlarge it to make sure that they can see it. Trial run. Tip number 8 is trial run. It's important to have trial run, but this is one aspect that I would say was a challenge for us, because we didn't have enough trial run with SPs. We had one trial run with them, so they requested more trial run in the future. Okay. Use external communication channel. Okay, when the OSCE was going on, we had helpline for examiners, students, and SP via WhatsApp. So while the OSCE was going on, our WhatsApp was beeping every 2-3 seconds from the students, especially from the students, because they were nervous. Despite us giving them the schedule, because students are given a schedule on what time is their OSCE, what is the allocated time. But being students and being nervous, they would WhatsApp us all the time asking when is their turn, what happened, what's happening, why the examiners didn't call us. Okay, so those were the challenges that we had. Students very panicking and not knowing what's going on. But with the help of my tech team, they managed to calm the students down, and my tech team had a list of where the students belong to, at what time and where the students belong to. So every time a student comes, starts WhatsApping and panicking and asking when is their time, then our tech team will find out from the master sheet that we have to tell them, okay, your time is 5 minutes, your time is slightly delayed because the students before haven't finished their session, so calm down. So those are the things that we had to do to calm the students down. Okay, and then SPs as well, sometimes the connection got off or the examiners got off, and then the SP will ask us, where is the examiner, those kind of things, where is the student. So we would, because we have the links to all of the exam rooms, so we would go inside the exam room and see what is going on, and then we will get back to whoever is calling us for help. So yeah, having WhatsApp was really helpful to solve all these technical problems. I have a backup plan. That's my last tip. Have a backup plan, because you can never know what happened. So have a backup plan in terms of what medium to use. Like what happened to us. Initially, we planned to have it with WebEx via 10 breakout rooms proposed. But then suddenly, there was internet problems in the faculty, so we can't continue with WebEx. So straight away we changed to Google Meet. Then have a backup plan for examiners, because sometimes, they're not comfortable with, they had some problems and they couldn't make it. So we had to find quickly, if you have a backup examiner, then you can address the issues and have a backup SPs as well. Okay, I am really early ahead of time, Dr. John. So I would like to say my special thanks to all involved, especially the management of faculty, the Department of Pharmacy Practice, because all of them were involved as examiners, as case builders, as mentors, because we had so many problems when we were planning to do this. But I had the support from all of them, from examiners, from SPs, from students, from my tech team, Izzati and Zakia. We were talking about OSCE for 2 months, non-stop, morning, day, night, evening, dreaming about OSCE. We were thinking how to do this and that. We had various plans, and I don't know how to say. It was a roller coaster ride for all of us. But yeah, I could have not done it without their support. So this is a picture of all the SPs involved, of our alumni. Again, we only had 2 days to look for them, because initially we planned for different SPs. Then suddenly there was MCO, we couldn't go to the lab. Initially we planned for SPs to be from our lab staff and from our postgraduate student, but we had to cancel that because we couldn't go to the lab. And we had to look for different sets of SP, 23 of them, who are our alumni. So they were very kind to help us, even in the last minute. And yeah, that's it. Thank you. I'm sorry, Dr. John, I'm very ahead of time. So I think we can go question and answers if you like.
Thank you very much, Dr. Hanis, for taking your time to prepare for us such a wonderful presentation. Okay, that was absolutely insightful and refreshing. And also thanks for the tips on how to conduct the virtual OSCE effectively, especially when you say you have to do a lot of rehearsals, and also you have to have backup plan. And I agree with that to ensure the success of virtual OSCE. So now I would like to open the floor for Q&A, and at the same time, you may also type in a question in the chat room. And I see there is one question from, let's see, one Linda. How do you make sure that the SP does not leak questions to their students? Do they have to sign any confidentiality document? Anything? Would you comment, Dr. Hanis?
Yes. I forgot to tell you that we had integrity pack for SPs and for students, not to leak the questions to anybody. And all of the questions, all of the SP scripts were password protected. And they only, like for our SPs, they only had access to their cases on the day itself.
All right, thank you, Dr. Hanis. Any question from the audience? Any more questions from the audience? By the way, the attendance link is available in the chat. You may proceed with attendance link, filling in the feedback and also your attendance. Any more questions for Dr. Hanis? We can take a few more questions if there is any, since we are kind of like ahead of time. So more questions.
Dr. John, there's a question from Prof. Aisha in the chat box.
Let me check.
Oh, I could see the question.
Oh, yes. Right. I read out the question for you. Okay, question from Associate Professor Dr. Aisha Saad. Would you and your team use this 100% virtual OSCE in the next semester? If not, why? Thank you.
Oh, that's a very challenging question to answer. I guess, well, I guess we would, if if it requires, we would, and it's an avenue for us to improve the way how we do things. So if need be, yeah, why not? We can try again next semester with an improved improved way to do things. Yeah. What is the best duration for Eastition? Now, we actually looked at several papers on how they set the time for each station, but of course we take into account of our students' feedback as well. So, like they were saying, they didn't have enough time for the counseling session. So probably we would need to increase the time there if we were to have this next time around. Yeah. Of course, we also communicated with our colleagues from other universities as well. The one that I remember from a good friend of mine, Dr. Izian from UM, from CCMS, from UIE. So we kind of like spoke to them and asked them how they handle their virtual OSCEs, and we shared, we compared notes and make sure that we are doing the right thing. Yeah.
Any more questions from the participants? If there is none.
Dr. Hanis?
Yeah.
Yes.
Yeah. Sorry, Dr. John, just a quick one. Do you face any technical challenges during this virtual OSCE?
Yes, we did, Dr. Aisha. The technical problems, like I said, were students having disconnected, examiners disconnected, SPs disconnected from the GMeet session. So what we told them, if they are disconnected, all you need to do is stop the time, because everything is time, right? So stop the time and then they come back to the session and resume back the time. Okay. In cases where students, because as you see, it's the session runs one after another. So one student has 18 minutes, and then when the 18 minutes is up, goes to the next student. Okay. Sometimes the examiners invite the students via email invitation, right? But then the student didn't enter the session. Okay. So sometimes the examiners will call the student and ask them, where are you? Why aren't you in my session? Or then if the time is too long for the examiners to wait, they will they will proceed with the next student. So the first student who has missed his session will go to the last turn. That's what we told them to do lah. They will have to wait until the last turn, and then the examiners will call them again to enter the session. That's what we did.
All right. Thank you, Dr. Hanis. There is another question from Professor Manso. How do you gauge assessment and the degree of difficulty to course learning outcome? How do you gauge?
How do you gauge the assessment and the degree of difficulty to course learning outcome?
Yes.
Well, actually, the OSCEs were the level of difficulties for the OSCE were C5 and C6 because they had to critically find out what is the problem with the case and come up with an effective solution. So that's a C5, C6 already. Prof. Yeah, that's my answer.
Okay, thank you. And also there is comment from our audience that if possible, we would also suggest if in future we can also arrange, you may also arrange a seminar on clinical pharmacokinetics. Okay, so any suggestion, you may email to us at aishasaad@uitm.edu.my. Attendance link is posted in the chat room. So probably, Cik Azwa, would you like to post the attendance link? Thank you. So well, ladies and gentlemen, so I'm confident that you have learned new things from our e-learning series for today. And once again, thank you very much, Dr. Hanis, for your sharing. And also to our IT team, especially Ms. Azwa, the support from the Faculty of Pharmacy UITM, and the audience who stayed with us till the very last moment of this program. So, you would like to say, Dr. Hanis, that's all, I guess.
Thank you everyone for your time. For being with us. Thank you so much.
All right, so goodbye, and we will see you in the next series.